Well, today in medicine, we can talk about a few other sounds, right? So we have, well, the first one is going to be mitral valve prolapse. Prolapse is when it's not in the right side, like in the right side where it should be. It's slipped down. So here we see the mitral valve and it has a prolapse. It's inward, as you can see here. So that will be a it has a closing problem. So that's a stenosis. No, stenosis is a opening problem. Regurgitation. Yeah, regurgitation, as you can see here, is coming back. So yeah, it's a closing problem. And stenosis is an opening problem. So here, that's an opening problem. So we have the snap of the chordae tendineae or the opening of the mitral valve. So we can hear a click, but it's a non-ejection click because the ejection click is early systolic and here's mid to late systolic. Then we have a flat murmur. Some textbooks say it's flat, some say it's like crescendo, but I mean there's a murmur after. So we can see that the chordae tendineae, right? Then we have the aortic regurgitation. It's when the mitral valve open, go to the ventricle, and then when it goes out, what happens is that it regurgitates, aka comes back. So we have a early diastolic murmur, and because it comes from the higher pressure to the lower pressure, that's what's happening. But then the pressure they start to getting equal, so you have less and less blood flow. So that's why it's a decrescendo. We can hear that in the left sternal border. We have the mitral stenosis when it like can't open too good. So we have a click when it's open because of the rapid filling. We hear the murmur, the rumble. And then the blood goes here and have a stenosis can open too good, can open well. And then the ventricle gives a little pump so that any leftover blood can come through. So we have to have the opening snap, the green thing. Then we have the rumble, the crescendo, and we have the presystolic accentuation, which gets bigger. That's the ventricle. No, this is the atrium contraction. So it's an opening snap and a mid diastolic rumble. Extra hard sounds, we have the S3 and S4. The S3 is a volume overload. It's when you have too much volume here and we have a stenosis. And so we can hear in young people, that's okay, but in elderly people, that is a sign of CHF, which is cardiac heart failure, I think. No, cardiac heart failure. Um, CHF, it's heart failure. And the doctor will ask you to roll over your left side, and that would be the left lateral, the cubitus, and the doctor will auscultate, and the fifth intercostal space in the midclavicular line, and it will be better heard. And we have the S4, which is pressure overload. So here we have an inward um, hypertrophy. And so that will cause the S4, which is because of pressure overload. And we also can call it gallop. So ventricular gallop, and here's atrial gallop. And then we have the causes. So we have bicuspid aortic valve, normally it's tricuspid, but some are bicuspid. So yeah, they will they will get used faster. Also, age-related calcification, the same risk as coronary artery disease, like smoking, hypertension, hyperlipidemia, diabetes, mellitus is the bad one. Rheumatic fever, heart disease, signs and symptoms. You can remember as SAD, syncope, which is fainting, angina, which is heart pain, chest pain, and dyspnea, which is shortness of breath, SOB. Can have a clot, can have an LVH, which is left ventricular hypertrophy, that we can palpate in the PMI, which is the fifth intercostal space, the midclavicular line. We can also find it out because of the pulsus parius et tardus. Parus is like slow, and tardus is late. So it's weak and late, small and weak, slow to rise. Also, we have the MAH, which is the shearing of the red blood cells. And in the systolic ejection murmur, with or without the ejection click, it can be heard in the right upper sternal border. The causes are widening or aneurysmal change of aortic annulus. That can happen because of tertiary syphilis or connective tissue disorder in the in the aortic valve. Also because of endocarditis or rheumatic fever. The symptoms are fatigue, syncope, shortness of breath, and palpitations. Also, we can have widened uh, pulse pressure. Pulse pressure is the difference of pressures. So in a normal heart, it would be 120 to 80 millimeters of mercury. But when you have a stenosis or a regurgitation, it could be like 140 to 50. So that's bad. Also, left ventricular dilatation with a S3 or displaced PMI and a early diastolic murmur. And so here are some sounds.